I'd like to start off with a question on behalf of someone from Vancouver who was unable to attend the session today. Her question is, after 3 initial chemos and 30 radiation treatments, I am now on oral chemo 10 days per month for reoccurring ovarian cancer. Should I be on a low-fiber diet? Does taking the drug domperidone help? Also, I am on 4 Senicide tablets and 4 stool softeners daily for constipation. Do you have any alternative suggestions? Dr. Ellett?
I'll start with the last part first. When you're on a Senecot type product, you need to make sure you're drinking lots of fluid because otherwise it turns into like cement in your system. So the first thing is to make sure that you're well hydrated, and that shouldn't just be water. It should be other fluids like the Gatorade that was described before, because water alone is problematic. And it's important not to drink things that'll dehydrate you, like coffee, tea. If the Senecot and the Colace aren't helping, then one of the ways one can move is to add oral lactulose. I know it's really sweet, but it is one of the positive ones before moving on to laxatives. Laxatives such as milk of magnesia or a little bit of mag citrate can then be added if the lactulose isn't working. If somebody gets into the process of vomiting as part of dealing with the diarrhea, they need to seek medical attention to rule out that something else is not going on, like a kink in the bowel.
I agree with all that, and some of the strategies that I already discussed earlier that maybe she could try.
Thank you. So we could open up to questions from other listeners.
Thank you. Ladies and gentlemen, we will now conduct a question and answer session. If you have a question, please press the star followed by the 1 on your touch-tone phone. You will hear a tone acknowledging your request. Your questions will be polled in the order they are received. Please ensure you lift the handset if you are using a speakerphone before pressing any keys. Your first question comes from Shartini.
Yes, thank you. I am a oncology dietitian at the Center for the Southern Interior in Kelowna, British Columbia. I was very interested to hear your presentation, and I have a couple of comments. In our experience with our gynae patients is that a high-fiber diet to deal with constipation actually does not work very well. One of the concerns that we have, first of all, with a high-fiber diet is that we are concerned about obstruction. And also we find that when women are going through treatment, really the most important focus is to make sure that we get enough calories and protein. And typically high-fiber foods are poor sources of those nutrients. So in our practice, and I would be interested in finding what your practice is, really the best intervention for constipation is really to encourage individuals to follow a regular bowel regime. So that's one comment that I have. The second comment relates to the misconceptions that exist relating to the content, the fiber content of food. And I'd like to emphasize that from our experience and from some of our reading that we have done, is that really tolerance to fiber is a very individual thing. As well, a common misconception is that fruit juices are high in fiber, when in fact they're not. Prune juice is definitely a high-fiber juice, and any kind of juices that have whole fruits in them and pulp. But anything else is actually very okay, and people can absolutely consume them, especially if fluid status is a concern. As well, another common misconception is that raw fruit is actually higher in fiber, or people should avoid lettuce. Actually, lettuce is full of water. It's a very low fiber food, and yet people may not tolerate it. So people can have actually green salads. They can have raw fruits depending on whether that specific fruit or vegetable is of a high fiber content. Really what affects the fiber content is if you have a fruit with the peel on or seeds in and you're consuming it, that would have a higher fiber content. And here at the BC Cancer Agency, we do have a provincial booklet on low-fiber foods, and we very clearly identify low fiber versus medium versus low. And again, a very important thing to emphasize is that it's an individual tolerance for the patient. We don't have hard and fast rules. Thank you.
Thanks. That's very helpful. Any comments, Dr. Elliott, Janet?
Well, I do find that many of our patients are, because of the bowel-associated symptoms, we do have to resort to low-fiber phased diets with them. So all her comments are quite valid.
Thank you.
Thank you.
Your next question comes from Diane. Please go ahead.
Hi, my mother, she's had 2 recurrences of ovarian cancer, and now there's a mass very close to her rectum, so it's the added problem of being unable to pass stools. She's taking a lot of stool softeners, including Colace, including lactulose, but then it becomes a situation that she can't even walk away from the bathroom because she has accidents. It just pours out of her. And there's a lot of mucus loss, so she has basically no freedom to do anything. If she stops, then she becomes completely constipated within 24 hours. Is there anything that can be recommended for her to be able to manage her life better?
Dr. Ellen?
One of the options, depending on where she is at in the course of her treatment, is whether or not there's a role for colostomy. And certainly if her treatment isn't working, that may be the direction that the doctors advise her. If she's at the beginning of a current regimen of treatment, you may want to wait 2 or 3 cycles to see if the mass will resolve enough to improve the bowel function.
She's not at the beginning. Actually, she's been having chemotherapy. She's no longer responding to carboplatin and Taxol, so they've got her on Calyx, and she's been having treatments it was a year in August that she started her latest round, so it's over a year now.
So this is something that you have to discuss with her doctors as to, is life so bad the way it is currently that she would want to have some sort of other intervention?
Okay, because I know that when they were talking about a colostomy, the oncologist said not a good idea because they didn't want to be operating when there was like tumors and they didn't want the cells to get around. I don't know. It sounded like it was worse to do that than to try to soften things until there was a reduction in the mass. So we feel like we're not having many options right now, and there's just no quality of life for her. But I don't know if she's sick enough to not have the quality of life. You know what I'm saying? I think it's all the result of all the medications, and she's just really dispirited, and it's really hard to try to manage this as well as we can. So she's basically barely leaving the house anymore.
If she's under the care of a medical oncologist, you could ask for an opinion by either a gynae-oncologist or a surgeon, whoever else is available at your center.
Mm-hmm.
And it's not that you have to follow that opinion, but it can allow you some options.
Yeah, no, it is a gynecological oncologist, so.
There are some centers that are also doing some interesting radiologic intervention by putting stents in.
Okay.
I know that's available in Hamilton. I don't know the names of the other centers where that is available, but that's usually done through the gastroenterology service or through the invasive radiology service. So
okay.
That's another avenue.
Okay. Thank you.